Good evening, everybody. نبتدي يا دكتور. Effective local warming technique in wound temperature pain and healing of non.
تعرف نفسك.
أنا الدكتور أمير الحريري، مدرس سعد جامعة حلب بسوريا، طالب دكتور كانديديت هنا بالألكسندريا يونيفرسيتي. Effective local warming technique in wound temperature pain and healing of non-ischemic diabetic wounds. Diabetic wounds are one of the most severe complications of diabetes, and more than half of those wounds become infected and increase the potential for this wound to get worse and compromise the safety of the limbs and even threatening patient life. To avoid such complications, it's very important to follow a strict program for the prevention and treatment of wounds, as well as proper management of infection. Accordingly, it's critical to find and develop a new cost-effective method and techniques to prevent wound infection and accelerate healing. Our case to present is a 25 female patient with diabetes and hypertension. She have fifth two amputation before 3 months. Her main complication was severe pain, swelling, tenderness, fixed ankle joint, extensive edema, and malodors. By examination, the right lower limb duplex shows atherosclerotic change with triphasic form, wave for femoral, popliteal, posterior, and anterior tibial arteries. White blood cells was 12,000, and hemoglobin was 10 gram. Distal pulsation was felt, ATA and BTA. Temperature of the limb was warm. Capillary refilling immediate. Motor power decreased. Sensation preserved. Lymph girth increase, edema present and extend to retromalleolar. Calf muscles, there is no tenders. Our examination for the ulcer, as shown from the picture, she have fifth two amputation before 3 months, failed to respond to antibiotic and arterial treatment on frequent dressing change, and nominated for metatarsal or below-knee amputation. She complained from severe pain at score 8 from 10. As shown from the picture, we have necrotic and sloughy tissue and exposed tendons and ligaments and even exposed bone. With high cloudy thick, purulent exudate and not distinguishable diffuse damage wound age. The surrounding skin also show severe edema, erythematic and macerated skin. Wound odor, yes, and vascularity was good. For such wounds, what's gonna we do? It's look like it's not salvageable. What gonna we do? We put it in a vacuum, natural silver, even from Biblex Egypt, for an example. It's we know it's high cost effective, but we follow a strict plan to initiate inflammatory process. The first purpose is how to release edema, how to initiate inflammatory process. So we're starting by inducing heating shock. Heating shock by warming this infected solution as normal saline and betadine. Heating shock release something what is called heating shock protein. Heating shock protein has well-known in hemostasis and bring more fibroblasts to the wound and induce immune response. We follow strict dressing methods every 12 hours, rehydrate wound age, bathe by selective debridement of non-viable tissue, manage bacterial burden by cauterized wound bed by warming disinfectant solution, betadine and normal saline, and also we have modification of betadine for 4%. Manage extensive exudate and edema by irrigating wound with warm disinfected solution and applying warming bag 3 times daily. Protect granulation epithelial tissue by preserve tissue viability and decrease wound temperature loss also. Follow strict dietary plan to control blood glucose level and improving hemoglobin. Our outcome as shown, complete healing of the ulcer with preserved sensory and motor power. After 12 weeks, our disclosure was warming technique is cost-effective method that helped to reduce wound parameter, pain, Signs of infection, improve healing and reduce the upset accompanied with irrigated bicol solution. Thank you so much.